Give you 2 quick pieces of advice for bringing people back to you, and it all centers around them having a good experience. So we all know that needles hurt when they go in the skin, and we all know that people will bear through it, but what we don't know is what they think about their experience when they leave, whether it be microneedling or tox or filler. Like, how painful was it and how uncomfortable were they? Because that is going to affect how quickly they come back. We all know that we like the results, so most of us eventually will get up the nerve to come back again. But if something was really painful, they actually might just put it off and put it off and put it off and maybe never do it again, or not do it near as much as they would if they were comfortable. So 2 pieces of advice I have for you to make their experience better. 1 is numbing the injection site where you're gonna do filler. I know this is not commonly done, but trust me, it makes their experience better, and they will come back more because of it, because they won't be afraid. So even though lidocaine burns, like if you've had lidocaine for stitches or for whatever, you know it burns, but it's amazing how if they can focus on the sting when you're doing the injections, then when you do the filler, it's like they just relax, and you just a completely different like aura comes over them. So we use Darby Dental. We get the little Septicane vials. If you want the link, we can provide that. It's super easy, super nice, and you can just, it's almost like 1 per person. It's really, really cheap. It does have epi in it, so you get some vasoconstriction that helps with bruising. Or you can just use regular lidocaine. The reason why I don't use lidocaine that much without epi is because I feel lidocaine without epi just kind of disperses. And so the only time I use lidocaine without epi is for Sculptra, or if I'm mixing in it with some filler. But if I'm doing it to numb an injection site, then I'm going to do it with epinephrine, and just kind of holds it right together. I'm telling you, that will really help, and you'll see it. And it's really obviously, like, I don't really use it when I'm doing lips, but cheeks, temples, jawline, anytime I'm doing a cannula site for sure. And I myself have had it both ways, and I myself much prefer numbing the site, getting over the pain of the lidocaine, and then you can just relax, because then you can't feel anything. So that's number 1. And then number 2, use Arnica. I think a lot of you do use Arnica after injections, but it just instantly takes that sting away. So really recommend that you have Arnica with every injection, whether you're doing filler or you're doing neurotoxins. Do that Arnica afterwards, a little bit of lotion, a little bit of tinted sunscreen, and they're gonna feel so much better, and it will just make their whole experience so much better. So